Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and one of the MCs here at Gold Learning. Well, this week we're talking all about our Gold Midwifery Online Conference 2026. And I have to say, I am just so excited about the content that we have this year. It by far it's just dynamic and exciting, new. Um, Obviously evidence-based, all the things that we love, but there's also things that are very specific and detailed, the things that you've been asking for, and we are bringing it to you this year. We've also got an incredible lineup of speakers, and that, of course, includes our speaker that we have with us here today, Loredana Zordan. It is so good to have you back with us here today at Gold Midwifery, talking about Moxibustion for breech presentation and postnatal recovery. Welcome to Gold. It is so good to have you here today.
Thank you, Fiona. I'm very happy to be here because I strongly believe that more midwives and birth support will know about using Moxibustion for turning the breech. We say reduce the number of cesarean section and reduce the
Yeah,
medication of
absolutely.
childbirth. Yeah.
Yeah, it really is incredible that, after all this years talking about moxibustion, I think that's still, still not used prevalently in practice, but yet when it is used, we see it be effective. You and I were talking about this earlier, but I want to know more about sort of your personal doorway, as we call it here. Tell me a little bit about, we know that your work bridges from midwifery, acupuncture, and education. I mean, I love that, you do all those things. But tell me what first drew you to moxibustion and how did you begin integrating this into pregnancy and postnatal care?
Yes, I believe that like you said before, Moxibust is an easy technique to use it. And and I strongly believe that there's still not many midwife and birth support they know how to use it. So sometimes women they don't know where to get it, the Moxibustion. And
Right.
it all started from that. I always been a midwife that thinking that women should do something for themselves, you know.
Mm-hmm.
And so I believe the Moxibustion is a tool that can be used to support normal birth and reduce
Mm,
definitely cesarean section. So this is my sort of I strongly believe in physiology, and I
yeah.
strongly believe that women need to do something for themselves,
Yeah,
give them power
absolutely. Yeah.
to have a better birth.
Yeah. And you mentioned obviously breech presentation, and postnatal recovery can feel, I think sometimes it can just feel so limited today. When people, you hear, women talking about, having breech presentations, not having any available options. From your experience, where do women and families most benefit from additional support approaches like moxibustion?
Yes, first of all, I believe that is something on education.
Mm,
Women don't know that they can have using moxibustion. And if you think
right.
about talking about research, if you do external cephalic version, it seems to work 50% of the time. Whenever, if they do 60, moxibustion is useful.
Hmm.
60% of the time it seems to work. It's a very easy to use it. So I think
Wow.
that women should know about that is an option available that is like a choice of
Right.
something they can use it. So I think education is very important. And secondly, which I believe I strongly have been teaching this technique to midwives from all over Europe, and I
Hmm.
think that there is really a need that midwife and birth support and know how to use it to offer a choice to women, basically.
Yeah.
At the
Yeah.
moment, there is no much choice
Yeah. No,
regarding.
absolutely. And I think it's so interesting because that's something we can all agree on. There needs to be choice, there needs to be informed decision making. Moxibustion is often described, as you said, as simple, safe. Yet it's still, I think the struggle is it seems like it's unfamiliar to many clinicians still, midwives included. What are some of the key principles that midwives need to understand to apply or teach this technique responsibly?
I think they need to learn that, for instance, the the guideline for cesarean section in New Zealand,
Mm-hmm.
they seem to recommend it to use Moxibustion. And in New Zealand, to give an example,
Sure.
um, all women that are
Mm-hmm.
breech, they are going to have a Moxibustion. So how
Mm,
effective it is. So I think it need to be accepted from the medical profession.
right.
A midwife need to know that there is a chance of having it, that they need to offer. And the other thing is that I strongly believe that women need to know how to do it because they need to do, usually you show the woman to do it, okay,
Right.
or the
Yep.
pattern, and they need to do for 10 days. So this is a lot about education. But obviously, like you said before, midwife need to know how to do it. And this is
Mm-hmm.
sort of my birth support and as well, obviously. Um, so my view is that is what I'm doing. It's part of my role is to teach midwives and birth supporters to do it. And then they will teach the woman, empower the woman to do themselves or the partner. And this is going to work because
Yeah.
they need to do 10 days, there is a protocol, they need to carry on doing it,
Mm, yeah, no, absolutely. And
Thank
I love that you talk about that because I think that, again, education is kind of the key, but looking at safety in birth is something that is talked about all the time. We know that there is again, risk factors of, breech and cesarean birth. They coincide, they coexist today, which is quite unfortunate, but we know that it's, education is something that we need more of and how, really Moxibustion should be part of that. It's almost like it's separate, Loredana. You know what I mean? Like it's an afterthought, or maybe it doesn't even come in the conversation. But it sounds like in New Zealand, like you said, they have it
you.
drawn alongside.
It's
They
included,
have,
yes. They
yeah,
offer
they've
to all women.
included it. Yeah,
Having said
which
that, in New Zealand,
yeah,
60% of the midwives use use
yeah,
acupressure. Okay, so they are into this sort of holistic care.
yeah,
So I don't see they can do in Australia, even New Zealand. I don't see why they
yeah,
can do, can be done everywhere. You
yeah.
know,
No, absolutely. Yeah, we need
especially
to.
because if you're having a elective cesarean section for breech,
Yeah.
it's most likely you're going to have another section for the second baby.
Mm-hmm.
So preventing, if it seems to work 60% of the time,
Mm-hmm.
is a lot
It is a
without
lot. Yeah, it's
be a safe
incredible. Yeah,
be a safe practice.
yeah, absolutely. Absolutely. So we've talked about, moxibustion as a way to sort of expand midwifery autonomy of sorts,
Mhm.
and also choice for families, which is one of the key things. Like we said, this is something we can all agree upon. What do you most hope for during your presentation on this topic? What are you hoping that participants will take away from this session?
I think that is sort of encourage knowing because like I said before, I got the feeling even in UK, I used to work in UK as a midwife, and even in UK where there is like the Royal College of Obstetrician actually recommended to use it. I still
Right,
found talking with my friend that women don't know how to do it, basically.
right,
Women, they don't find a midwife that knows how to do it. They think that only acupuncturists can do it, which
right.
is not. So the goal of my presentation, the goal of my teaching, I do a lot of practical workshop all over Europe and Italy. The goal is more, more midwife and more birth partner, the partner, they know how to use it,
Hmm.
Moxibustion. More women will have the chance to avoid a cesarean section.
Yeah,
So this is my
absolutely. And for
goal.
safer birth, safer outcomes, I think this is I mean, it's all part of the big picture, for sure. Loredana, tell us just briefly. I know that you have now written the book on it, essentially, and what a wonderful opportunity for our viewers to read and understand more. Tell them about your book, and I know you said you're doing courses, your website, they can get more information. Can you just tell people how to find you?
Yes, this book is comes around like is acupressure motivation for childbirth, okay? And
Mm-hmm.
as I say, it's come across because I've been learned this thing from Deborah Betts, which is an acupuncturist. She's an expert on things. And after I've been teaching for many, many years this topic, I think I thought that about writing a book. So I'm very proud of the book because there is a lot of testimonial
Yep.
and it's quite practical. It's a manual, a lot of nice picture, and we'll be talking about acupressure for labor preparation, induction of labor, pain relief in labor, and then Moxibustion for turning the breech, anemia. But what I think that I think the good is important that I try to write in an easy way, talking
Right.
about Chinese medicine. There is
Mm.
like a 50, 60 page an introduction where I try to explain the benefit of
Mm-hmm.
using uh, Chinese medicine for the midwifery profession, for the midwifery. Um, yes, so my book can be found on Amazon. However, on my website, there is a lot, like Fiona was saying, there is some video, they can get some information. There is a link for the book. And I'm quite proud because the book is being first in Italian, published in Italian, then in English, and now in Spanish, because I think
Oh,
Spanish is the
beautiful.
second language spoken in the world. So, yes, my website is www.loredana, which is my first name, Zordan.com. Feel
Beautiful.
free. Okay, yes,
Yeah, go ahead. Go ahead. Yeah. That is
Okay.
that is wonderful. Yeah. So you can find more information there. And of course, we're so excited because you're going to be with us here at goldmidwifery.com. So you can head over to the website right now, goldmidwifery.com. Check out this presentation, Moxibustion for breech presentation and postnatal recovery. We're very excited to have you with us. And of course, you'll be here live answering questions all about the details, the research, and how it works. And then, of course, how to implement it into your practice. Great things here happening at Gold Midwifery. We're very excited. Thank you again for joining me here today, Loredana. It's been my pleasure,
Thank,
sitting down
thank
with
you,
you once
Fiona, all the
again.
brilliant gold team.
Yeah, thank you so
Thank you.
much.
They're
We'll
very
look
nice to
forward.
work with you.
Yeah, we'll
Yeah.
look forward to seeing everybody online. Bye bye for now, everyone.
Okay. Bye bye. Ciao, ciao.